there's a product embedded in our medical record that listens to the conversation that I have with patients, and in so doing, it creates a transcript where it actually gives it to me at the conclusion of the visit once I enter in the appropriate prompt into the note, and that turns into what I edit to do the note, ideally a little bit more quickly than if I were just doing this all on my own. So if we were in a different venue, we'd call this an ambient listening device, which is a little bit different than AI to automate certain functions on the operational side. But what I'll say is a couple of things about this. So number one, I think I think that we should be thoughtful about understanding how data is going to flow in this current era. So the data that we collect through this device, I, as a physician, as a board-certified physician, am actually curating this information, because what happens is I receive a transcript through the technology, and then I have to edit that information. What I'll just tell you in all honesty is that the technology gets a lot that's wrong, okay? It will misidentify people's conditions, it misidentifies their gender, it misidentifies the timeline of when things happen, and these are clinically very relevant issues. So this is not minor issues. Now, what we're told is, so then the question becomes, well, what happens after I curate this data? Well, it's retained by the company for a process, in a de-identified way, for a process that's known as product improvement. So that's interesting, but what that basically means is that I'm sitting in the room curating the data for the company, and then I'm handing it over to them so that they can improve the product. Well, it's not hard to kind of think that there's a future in which they're going to plan for the technology to be able to interface directly with the patient without me being there. And it's actually going to use a patient's demographics and the information that's collected to offer suggestions without me needing to be there. So it automates my clinical role. And you don't have to take my word for it. Bill Gates is on the record as saying he thinks AI will replace doctors in the next 10 years.